I'm Dr. Divya Bansal. I'm a clinical hematologist, hemato-oncologist, and bone marrow transplant physician at Manipal Hospitals, Dwarka, New Delhi. Today, we will be discussing about a very common kind of a cancer known as blood cancers. So, to understand what are blood cancers, basically, blood cancers are those group of cancers which involve the production and function of the blood cells. In our blood, we have the red cells, white cells, and the platelets, which do various functions. When the white cells, which are primarily involved in prevention of infection, they turn cancerous, most of the blood cancers arise due to that. So, because of these abnormal cells, which take over the space for normal cells, the function of the blood, that is carrying the oxygen, fighting against the infections, and stopping bleeding, these functions are hampered, and these problems lead to various symptoms in blood cancers. Now, what are the types of blood cancers? Mainly, there are three types of blood cancers. We have leukemias, lymphomas, and myelomas. Leukemias are those kind of blood cancers where the white cells, that is why the name leukemia, are abnormally proliferating in the bone marrow, and because of which there is no space in the bone marrow for the normal cells to be produced. Because of this, patient present with anemia, they have bleeding, they have increased risk of infection because the abnormal white cells, they are not capable of doing their normal function. Second type of blood cancers, which are the lymphoma, they are the cancers of the lymphatic system. What is lymphatic system? Lymphatic system is basically that part of the system which is involved in filtering of the waste products. So we have various lymph nodes, spleen, and bone marrow, which are the part of lymphatic system. There in lymphoma, there is abnormal production of lymphocytes in these lymphatic system, especially in the lymph nodes, and because of which patient develop various symptoms. Now, the third type of blood cancer, which are the myelomas, these are the cancers of special types of cells which are known as plasma cells. What is the role of plasma cells? Plasma cells are involved in production of antibodies. Now, when these plasma cells, they become cancerous, they lead to various symptoms like, bone involvement, anemia, kidney involvement, and various other symptoms. Now, talking about what is the cause and the risk factors for these blood cancers. So, basically, the exact cause is not known for most of the blood cancers. Uh, Generally, they are not genetic. Most of them are acquired because of some genetic mutations or some genetic abnormalities that happen during the lifetime of a patient. But very few, especially in very little children or infants, can be congenital, which can be passed on from their parents. Environmental factors like radiation, previous chemotherapies, any drug abuse, any smoking, these kind, like any other cancer, they remain a risk factor for blood cancer, but there is no causal association associated with any specific kind of blood cancers. Talking about the age, few cancers like ALL, Hodgkin's, these are seen commonly in younger children, whereas cancers like CLL, AML, and other cancers are seen more commonly in the elderly. The symptoms of blood cancers, they mainly arise because of the dysfunction in the cells. So, because, as I explained, there is decreased production of red cells and platelets. So, generally, these patients, they present with anemia, they present with bleeding. Because of that, they can have generalized weakness, fatigability. Patient will be very lethargic all the time. Fever can be a very common presenting symptom, which is not, you cannot know why the fever is, no infection marker is coming positive. But sometimes, because the immunity is also poor, repeated infections can happen, and these patients can also present with fever. They can be nodular swelling, especially in lymphomas and ALL kind of blood cancers. There can be nodular swelling known as lymph nodes in the neck, groin, or the axillary area of the patient. Patient can have weight loss. They can have night sweat, especially in lymphomas. They can have night sweats. Then they can have bony pains. In myeloma, patients generally have backache or other bony pain because of draining of calcium from the bones. They can present with kidney problems because the heavy globulin chains formed in myeloma, they get filtered from the kidneys, and there can be shortness of breath and all these symptoms which generally patients present with. Now, coming up to the treatment of blood cancers. So, chemotherapy remains the mainstay of the treatment of blood cancers because radiotherapy has a very limited role, like especially in few lymphomas and solitary plasmacytomas. Generally, the treatment is chemotherapy and now targeted therapies, which are very commonly used for various kinds of blood cancers. Curative treatment still till date is bone marrow transplantation, depending upon the type of blood cancer. For myelomas and lymphomas, autologous blood bone marrow transplant, where patient own cells are harvested after the disease is controlled. And whereas leukemias, we prefer allogenic transplant, where we take cells from some other donor. So bone marrow transplant remains the curative treatment for these patients. Not only main treatment like chemo and bone marrow transplant, but a lot of supportive treatment is needed in these patients. Like we have to give them the infection treatment has to be done. Various infections have to be treated. We have to give them regular blood products. As I explained, their patients have anemia and low platelet count, so they may need blood products transfusion during the course of treatment and at presentation. Psychological support is needed for these patients. And then also these patients need support in various other forms. I, as a doctor, would always say that these are very, very financially draining treatments because they are expensive treatments, and we should consider medical insurance in patients. And we always encourage patients to have medical insurance that cover cancers, because these treatment then can be easily taken in any private hospital where you have the facilities available. Thank you.